Good morning. I'm Don Walker, and I'm Communications Director with Brevard County Government, and this is our weekly update on COVID-19. And today on our panel, we have John Davis, who's Community Health Coordinator with Brevard Health Department, Brevard. Maria Stahl, who is the Administrator of DOH Brevard. We have John Scott, our Emergency Management Director. Mark Schellmeyer, Chief of Brevard County Fire Rescue. We also have as a special guest today, State Representative Randy Fine. And we have our social media specialist, Jesse Ray, who will monitor this Facebook event for your questions, and we'll pose those to our panel once we've completed our updates for the week. So we will start off with our usual update from Florida Department of Health Brevard. I'll turn it over to John Davis. John?
Thank you. So looking at this week's number, we did come down a bit with cases per 100,000. Last week, we were at 744 per 100,000. We're down to 735. That's good, but still, it's extremely high, and I want to emphasize that these numbers I'm going through, while looking better, and we're hopeful that that's starting the downward trend, but I'm a little reluctant to state that we are heading downward at this point. It's a slight shift, and we're happy about that, but still these numbers are extremely elevated. Hospitalizations, they tend to be steady, having some stabilization there in terms of admits. ICUs still struggling. Staffing is continuing to be a big issue at the hospitals. In terms of vaccination, we did 1,100 fewer first doses this week than last week. So again, that's a bit troubling. I'm always remiss if I don't encourage vaccination. It's, again, like I said last week, the biggest tool we have in our toolbox, and we need to utilize that. Slight increase in percentages of 12 to 14-year-olds vaccinated. That age group is now 38%. Our 15 to 19-year-olds are at 45% vaccinated. Deaths, again, over the last few weeks, they have been elevated. We have seen them triple since the beginning of the summer on a week-to-week basis. In terms of testing, I know that's been a big issue in the community. If you remember, before the vaccine was available, all our resources were going towards testing. But as the vaccine became available, obviously we had to ramp up with that, and that became the main focus of the activity, was to get as many people vaccinated as possible. Now with school back in session, I know that the testing availability has been a big concern. On that front, the Brevard public school system has done a good job of creating some testing for students and staff. We worked with them and doing site-specific testing in the north end of the county earlier this week, and we now are doing weekly or daily testing, I should say, at the health department. Starting next week, Monday through Friday, 8 to 6, we will be testing at the Vieira facility. This test is open to anyone. You can go to our website and register. The results will be provided in electronic form, so you will have proof of your results. And again, so we are working hard to crank up testing, because again, I know parents are really wanting to get their kids out of quarantine. One thing on that front is, keep in mind with the quarantine, when your child is tested to get out of quarantine, they have to be at least 5 days beyond their last exposure for that negative test to count in getting them out of quarantine. So I just want to reemphasize that, because we have seen some people come in just too early, like a day or two after exposure. So we want to reemphasize it needs to be 5 days post exposure date. And let me just say, again, I know the numbers are alarming with the cases we're seeing in schools and the amount of quarantine going on. I would just encourage, again, if your child is 12 or over, they are eligible to be vaccinated. And please keep in mind that children that are fully vaccinated do not have to be quarantined. Again, as I quoted earlier, we're at 38% of kids 12 to 14 covered, 45% 15 to 19. If we had higher coverage rates, we're going to have less quarantining going on. So there are things that can help: masking indoors, vaccination, social distancing. These things work, and I encourage the community to continue taking advantage of these tools that we have that we know that work.
Thank you, John. Of course, testing is one of the most common topics we're seeing on our social media platforms, so it's good to hear John say that there is some expansion that's coming on testing availability. For an update from emergency management, I'll turn it over to John Scott, our emergency management director. John.
Good morning, and thanks, Don. Again, my name is John Scott. I am the Director of Emergency Management for Brevard County. Building on some of the stuff John talked about, I want to talk about one of our newer tools in the toolbox for combating COVID, which is our monoclonal antibody treatment site at Kiwanis Island Park and Merritt Island. We talked about it last week. Excited to have it. Grateful for our partnership with the state to make that happen. I want to just go over a couple of the details again to remind people how they can go get the treatment and what it is. So again, it is a treatment. It is not a vaccine. Those are two very different things. It is a treatment primarily for those who are sick with COVID symptoms or believe they have a close exposure to someone who is COVID positive and themselves are either severely vulnerable to COVID or immunocompromised. So a couple of things about eligibility. COVID positive, COVID symptomatic, or been exposed, close contact with someone who is in themselves COVID positive. You do not need any sort of referral to go. You do not need to have a negative test or a positive test or any of those kinds of things. And if you're vaccinated and you're symptomatic, you can absolutely go and get the monoclonal treatment. The hours are 9 to 7 every day, Monday through Sunday at Kiwanis Park and Merritt Island. And again, it's free of charge. So they may ask you for your insurance information. There may be a small charge to your insurance company, but there is no charge to you, and insurance is not a requirement to receive the treatment. Again, the goal of this treatment is to help keep people out of the hospital, to keep your symptoms at a medium to mild range, and really help us decompress our overall hospital system. So far to date, and we started last Tuesday, so we're about a week and a half now, we have provided 2,032 treatments at that site. So again, continue to do great work there. Appointments are preferred, but walk-ups are also accepted. I remind folks what that treatment is. It is a series, it's given to you subcutaneously, which is a fancy way to say shots. That's 4 shots, 1 in each arm and then 2 in your stomach. And then once you receive those treatments, you'll be there for about an hour in observation. When going, I want to talk about a couple things people should do to prepare to go. One, please make sure you are well hydrated and you've eaten something on your stomach is always important whenever you're going to get a medical treatment of any kind. That will help with nausea, that will help with a whole bunch of things, and staying hydrated will also do those things. 2, you're going to be there for a bit. It's an hour in observation. It may take a little bit to get through the registration and treatment site, so you should plan on at least being there for a couple of hours. So bring a book, bring some music, bring something to keep yourself entertained. And then as a final reminder, people who are going are sick. And that's the whole point of this treatment, right, is to help those who are sick, provide them an option, and we hopefully keep people out of hospitals. So keep that in mind. Make sure you're practicing all the good COVID stuff we do, right? So masks, social distancing, using the hand sanitizer, all that kind of fun stuff. It is a great option for us to use, especially if you're experiencing symptoms, and the sooner you go, the more effective the treatment is. So that's where we are in the monoclonal thing. I want to talk also a little bit, very briefly, it's something I talk a lot about. I've talked last week about, talked the week before about. It's the importance of working to end the cycle of transmission. And that is out and above, sort of above and beyond any sort of treatment or vaccine and all those kinds of things. This is stuff we can do every day as members of this community to slow the spread. All right, so how do we end the cycle of transmission? We start by using our good COVID mitigation measures, and the biggest one being if you are sick, if you have some sort of symptoms, whether it's allergies, a cough, or whatever, and you're not sure it's COVID positive or not, err on the side of caution, stay home, wear your mask, avoid people, don't go out to places where people are gathering, start to go back to those low-risk activities where you're really trying to minimize who you interact with. You know, several weeks ago, John and Maria talked about the idea that the Delta variant is highly transmissible, has a much higher rate than the original version of COVID, right? So we're talking instead of 1 to 3, it's more like 1 to 8. So where we can make a difference is if we're one of those people who are COVID positive, by staying home, by doing all of the important COVID mitigation measures, we're not spreading it to 8 people, who then can spread it to another 8 people, who then can spread it so on and so forth. And that's how we get the growth we're seeing. If we simply stay home, we can end that cycle of transmission. And I cannot emphasize enough how critical that is. That's how we turn this around. That's how we begin to get our numbers on the downslide. You do the COVID mitigation measures, you get vaccinated, we do all of those things as a community, we pull together, and we get our arms around this thing. If we're not changing some of our behaviors, we're going to continue to be in this kind of situation. So we all continue to implore you, I implore you, please, 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 help us in the cycle of transmission. Stay home when you're sick. Don?
Thank you, John. So just kind of a short personal anecdote. I received an email yesterday from a woman who's said her daughter had started having severe COVID symptoms and wondered if she would be able to get into the Kiwanis Island monoclonal treatment facility. And I told her they were taking walk-ins. And to my surprise, at about 8 o'clock last night, I received a follow-up email from the woman saying that her daughter was able to get in and was already starting to feel better. So that was actually a good note about how the monoclonal treatment does provide you some relief. So for an update from Brevard County Fire Rescue, I'll turn it over to Chief Mark Schulmeyer. Mark?
Thanks, Don. Once again, my name is Mark Schulmeyer, Fire Chief with Brevard County Fire Rescue, and like I've been doing for the past few weeks, I'd like to start off with just a general overview of the health of our organization. As of today, 8/27, BCFR has 2 employees in quarantine and 7 in isolation. We do have 1 member that was hospitalized about 5 days ago with complications due to COVID. He's doing much better today and should be in the hospital for another week, so we wish him a speedy recovery. We are still seeing a steady number of transports of COVID positive and COVID symptomatic patients over the past week. This number is still way up from the numbers we saw in June and July, but somewhat less than we saw the first couple weeks in August. Once again, the daily hospital wait times for BCFR ambulances is slowly improving. Again, I like to be a little cautious about using the word trending, but we have seen some improvements in our ambulance turnaround times. Without sounding like a broken record, we continue to ask people to only call 911 in emergent or life-threatening situations, and to please save the ambulances and ER trips for those that need the services. BCFR continues to work with our hospital partners on a daily basis to ensure we are doing everything within reason to assist them with any capacity issues. As a reminder, when and if you do call 911, we will always be there to respond. There have been no delays in Brevard County Fire Rescue getting our EMTs and paramedics to the scene of an emergency during the pandemic. And Jesse, I want to hijack your Q&A for just 1 second because I received over the past several days a couple of complaints, and they're all about the same topic, and that is during the surge, we've had a couple of complaints or concerns that the people were transported to the wrong hospital. And so the situation was our EMTs and paramedics arrived, loaded the patient in the ambulance. They said they wanted to go to hospital X. We went to hospital Y. And they get to hospital Y, and they said, well, my doctor doesn't practice here. What do I do? And so the reason was during the surge, we had quite a few hospitals that were being on diversion. And so when they get placed on diversion, we only take the most critical patients to those hospitals, and we take all other patients to another hospital that we divert to. And so that is the reason why if you don't go to the hospital that you request, the hospital may be on diversion, which is a thing now. It has subsided over the past couple weeks, but Just want to let those people know that that's usually the case. If you don't go to the hospital that you want to, it's probably because they're on diversion.
Thank you, Mark. So, we've been holding these Facebook Live events for several weeks during the pandemic, and we started inviting some of our elected political leaders to join us for these updates. You could call it a press conference if you'd like, but we refer to them as Facebook Live events because we will be fielding questions not only from you, but also from the media. But since we have Representative Randy Fine here today, I was going to turn it over to the representative, who I understand you've had a personal run-in with COVID. Anything you would like to tell our audience today?
Well, sure. And let me start by saying thank you. Thank you for the invite. I'm happy to be here. Sure, I think most people know I had COVID. It was not a very enjoyable experience for me, and I don't wish it on anyone. I just came here actually from a funeral and from someone who died of COVID. And so this is real, and it is happening to people right now. I also want people to understand that we focus a lot on death, but COVID is not just about people dying. Many people have long-term effects. I'm one of them. Many people, I've shared this, I have to go get shoulder surgery at some point because I developed an infection in an old injury from 20 years ago because of the steroids that I had to take when I had COVID. And I don't say that for sympathy. I say that to point out there are many people. It's not just do you die or do you not. It's a question of what happens over time. I just want to encourage everyone to get vaccinated. And I had it, but I still got vaccinated. And I look at it this way. People want to talk a lot about natural protection. Well, my getting COVID is like the equivalent of having a coat on when I go out in somewhere that's cold. It might keep me warmer. But getting vaccinated is like putting on a hat and gloves and a scarf. It's something in addition to having it. And I think another reason for folks to think about the vaccine is, frankly, the quarantine issue. When we see the top 10 schools in Brevard County in terms of number of quarantines, they're all, I believe, middle schools and high schools. Well, almost every student in those schools has the ability to get vaccinated if a parent so chooses. I would never support vaccine mandates, but that doesn't mean you can't make that decision because you think it's the right thing to do for your child. So I would encourage that as well. We're continuing to work on testing. I know I'm continuing to sort of try to hook folks up with resources because there is a desire, frankly, to not have to make an appointment, to be able to just, to go and get it done. And then I think the last thing I would point out, you talked about, look, get vaccinated. If it doesn't work, go get the monoclonal antibody. I have a friend who has COVID, felt crummy, got it from his kid, went and got, like you went and got the monoclonal antibody treatment, and within 24 hours was feeling much better. Is it perfect? No. The vaccine's not perfect. None of this is perfect. What they are directionally helpful. And the last thing I would add, you talked about staying home if you have symptoms. I want to sort of take that one step further. One of the things I'm most proud about of when I got COVID is I didn't give it to anybody else. Part of the reason I didn't give it to anybody else, I not only quarantined myself, but you can do your own contact tracing. And so if you do happen to get COVID, call everyone that you were around for the last week and let them know. It's not a scarlet letter to get COVID. And so let them know, and so they can get tested, and so they can take appropriate precautions. Because just because you've stayed home doesn't mean you didn't give it to some folks in the 3 or 4 or 5 days or week before you realized you needed to do it. So staying home is obviously important, but you can do your own contact tracing. You don't have to rely on the government to do it. So happy to have questions, but we realize it's a problem. It's going to continue to be a problem. This is probably going to be with us to some degree forever. But we can only do what we can do to try to help, and that's getting vaccinated, getting the monoclonal antibody treatment if you do get it, and then obviously staying home if you do have it.
And Representative Fine, I don't mean to turn the spotlight on you, but we were having a conversation before our event started today, and you mentioned something that I thought was very eye-opening, is that when you had COVID, there are more things available today than there were available to you when you got it. I didn't know if you wanted to talk about that.
So I had it a year ago, just about a year ago now, last July. I was the second legislator in the state of Florida to get it, the first one to go to the hospital. And when I got it, I made a big deal about it on social media, in part because I didn't really know anybody who had it. I think back in last July, really none of us did. It was all sort of, it was all kind of not real, and I wanted to make it real. I didn't know that on the 12th day after I tested positive, I'd have to go to the hospital, and they'd admit me for it. But when I went, I was one of the first people to get remdesivir, which I credit with saving my life. I was going downhill fast, and within 24 hours to 48 hours, I was feeling better. I had to stay for a week because with remdesivir, you have to stay for all 5 treatments. They don't, or maybe it's changed, but a year ago they didn't. But, that was last July, last October, November, when President Trump got COVID. He was one of the first people to get monoclonal antibodies, which now anyone can get if you drive to Kiwanis Park. So that was developed. And the third thing, and it's not a treatment, but it is helpful, it is the vaccine. And I know people want to argue about it, but you can't argue with the fact that if you look at, I think Health First said 96% of their hospitalized patients are unvaccinated. I'm not trying to shame anyone or make anyone feel bad, but math is math. Facts are facts. And while it does appear that the vaccine will not keep you from getting COVID, it is incredibly effective, it appears, in keeping you from dying from COVID or going to the hospital from COVID. And if you want to avoid those things, 500 of our neighbors are in the hospital right now with it. And so if you want to avoid getting those things, nothing in life is risk-free. But if you want to avoid getting those things, getting sick, or if you want to avoid having to go to the hospital, if you want to avoid dying, the vaccine seems like your best way to do that. But if you do get it, again, hop in your car, go to Kiwanis Park, and get the monoclonal antibody treatment. So there are things that we can do, and technology will continue to change over time. And hopefully 6 months from now, we'll have something else as well. This is sort of an unfolding, pandemic in real time.
All right, thank you, Representative. Before we turn it over to questions, I am going to turn it back over to Emergency Management Director John Scott for a quick update on hurricane season. John?
Thanks, Don. Yes, I would be remiss, given the time of year that we are and the activity we're seeing in the tropics, if I didn't just take one quick second here to talk about the fact that we are going into the statistical peak of hurricane season. That's a fancy way for saying this is the heart of hurricane season. In Brevard, September and October are our 2 biggest and most frequent months for those things. So it's really important, as the tropics continue to do what the tropics do this time of year, that we're all taking steps to be prepared, that we have a plan, that we have a disaster supply kit, we know where we're going to go, we know how to get good information, and that we continue to be ready, we continue to monitor the situation and ready to act if and when those things happen. So just a reminder, the tropics are going to get busy, the tropics are going to stay busy for a while, so it's on all of us, again, to make sure that we're ready as a community so that should we need to act, we can do so quickly and effectively. Thanks, Don.
Thanks, John. And also one more thing before we go to questions. We understand that a lot of folks, due to COVID, are having economic hardships. The county still has $14 million in assistance available for rental assistance to help you from being evicted, and also utility assistance. So if you're unable to pay your gas bill or your electric bill, we have assistance available for you. You just need to go onto the Brevard County website at www.brevardfl.gov. Look under Housing and Human Services, and on their homepage, you will find applications for that assistance. Now I will turn it over to Jesse Ray for some questions for our panelists.
Awesome. Thank you, Don. Okay, so for the health department, with James Madison Middle School shut down and sports events being canceled, how worrisome is the current situation?
Well, it's extremely worrisome. I mean, we knew going into the school year that, again, dealing with the numbers we're seeing in the community and the fact that there were mitigation measures in place last year that aren't in place this year, yes, extremely concerned, and we're going to continue to see high numbers. Again, schools don't operate in a bubble. Schools are a reflection of the community they're located in. So when you see high rates in the community, you can expect you're going to see high rates in the schools.
Okay, thank you. John, or FDOH, the monoclonal, that is a treatment, not a preventative. Is that correct? There seems to be some confusion or debate in the comments.
Correct. It is a treatment.
It's a treatment.
A vaccine is a preventative.
Thank you. For FDOH, are we seeing deaths from the vaccines? Are people dying from getting vaccinated?
I'm not aware of any here in our county, no. However, nationwide, yes, there are some. Again, you have to realize at this point, you're talking individual doses in the 250 million or more. So there is a vaccine registry site where when you do have a death right after a vaccination, that's reported. But again, that has to be investigated and sussed out whether this truly was related to the vaccine or not. I don't think you'll ever get an exact number on that. But again, extremely small. I did look at what was posted, I believe it was the CDC website, and this was, I believe I looked at this 2 weeks ago, but there were a little bit over 6,000 that were registered as deaths possibly related to the vaccine. But again, that, those determinations aren't fully made sometimes for many, many months and sometimes not made at all. But again, you gotta weigh that against the millions of doses that have been given nationwide.
138 people, by the way, said they got pregnant in that same database after they got the vaccine. So that sort of tells you something about, that whether you can take it all at face value. And by the way, I guess if you want to get pregnant, getting the vaccine may help if you believe that database.
I'll add to that, Representative Fine, and just reiterate that the vaccine during pregnancy is safe. You should get it. We have seen deaths, and in fact, deaths in our county from pregnant women getting COVID, having to have emergency deliveries, and then the mom's not surviving. So I can't impress enough upon anyone. I mean, vaccines are important, but for the pregnant woman, definitely important.
And then Maria, kind of also on that, I think a lot of us have heard or seen that the vaccine causes you to be infertile. Is that something that, no, right?
No, there's no evidence of that.
Okay, awesome. Okay, so back to some of the questions that we've gotten. John Scott or John Davis, whoever wants to take it, if you are not sick, but someone in your family is sick, who should stay home?
If somebody in your family is sick,
Sure, so my child is sick and has a positive COVID test. Who all needs to stay home in that household?
well, again, we encourage, number one, if somebody's a case, to isolate. Representative Fine was going over his case where I think, if I remember correctly from some of your posts, you were actually isolated in your room at your house.
We tried, but
yeah, it's hard.
Everyone got it.
But again, as he said, this is a household decision, and I realize it's hard with particularly younger children. And if you're a single parent, I get it. But the recommendation is to have that case isolated within the home as best as possible. In terms of should you stay home, again, with adults, it's a little tricky because we do know that we have folks in certain segments of our society that are considered essential workers. Healthcare staff, law enforcement, EMS, those folks, if they're deemed essential, still come to work. They self-monitor for COVID symptoms for 2 weeks. If you're able to quarantine, I would recommend that, yes, you do stay home.
Okay. And I've got just a couple more, and they actually happen to be for you, Representative Fine. This comes from Dave Berman. You have been closely watching the COVID-19 data during the pandemic. Would you like to see the Department of Health increase the data it is reporting to the public, including death totals by county, which is not being done now? And what else would you like to see reported?
Well, I think it was reported recently. It's not being reported daily. But what I tell people from my old life is the importance of information. Is it actionable? And giving people numbers that don't facilitate action doesn't serve a lot of purpose. Whether we report the numbers daily or weekly, we know that the numbers are bad, and so people should be taking the appropriate steps. I think we're getting the right information, which is allowing people to take the right action. I think the most valuable valuable data that's being shared right now is information on hospitalization of vaccinated versus unvaccinated, deaths, vaccinated versus unvaccinated, which I don't know that I've actually seen that, but if that could be put out. But I think letting people make their choice, because nothing in life is risk-free. I'm not going to say getting a vaccine is risk-free. Getting monoclonal antibody treatment isn't risk-free. Nothing in life is risk-free, but it appears if you look at numbers, the risks of getting the vaccine are a fraction of the risks of getting COVID. And so I'm happy with, I think the numbers, the information that is out there is appropriate for people to make the right decision for them. I don't think throwing more numbers at people will necessarily change things.
Okay, and one more question for you, and Don, this will be our last question for the day. Okay. With the FDA approval of the Pfizer vaccine, a lot of states, companies, and institutions are using that approval as justification for putting mandates in place. So what is your stance on the vaccine and the mask mandates? I know we've talked about that a little bit, but if you just want to take that moment. For you.
I will never vote for a mask mandate or a vaccine mandate. I believe it is a person's choice. I don't think government should be forcing people to get the vaccine. I encourage people to make the choice I think is best, and I have every right to do that and share my opinion, but I will not vote to mandate the vaccine. I think it would frankly backfire. And there's difference of opinions, but all of the science that I've seen, including science that came out this week from Canada, indicates that mask mandates, particularly for children, are completely ineffective. And so I don't want to be pushing that. But I will not be voting for a mask mandate, nor will I be voting for a vaccine mandate. And frankly, if I go back to Tallahassee and I have the opportunity to make it illegal for government to create mask mandates, I will certainly avail myself of that opportunity.
Okay, thank you. Don, back to you.
All right, thank you. Representative Fine, thank you very much for joining us today. That concludes our update. Thank you for joining us. Thank you for your questions and providing us this opportunity to keep our community informed. A weekend is upon us. It's not a holiday weekend, but there's one coming up. So again, think safety first. Please follow CDC recommendations, social distance, keep your hands washed, wear facial coverings. Please get vaccinated. And thank you again. We'll see you in a couple weeks.